University of New York at Brockport. Kim, we're going to pass the microphone to you, and we're delighted to have you open this training section.
Well, thank you, Steve, and thank all of you for bearing with us. We're delighted that you're going to spend your afternoon with us, or at least a little part of it, actually. Let's see if we can get my screen up here. Can you see my screen?
Yes, I think we're set.
Yes, we're on. Okay, great. Thank you. Okay, well, what we're going to do, I'm going to start with the health coordinator's best practice piece, and then I'll be turning it over in a bit to Antoinette Meeks, and she will focus on the health education. So with that, Steve just gave me a wonderful introduction and told you about my past. This slide just tells a little bit about the work that I'm involved in now, and basically working on a state level, coordinating a variety of health initiatives with local districts, regional, and agencies and such statewide. This is the leadership group for the health coordinator section right now at ASHA. I'm the chair. If any of you know Sandy Clarenbeek, and I know she's on this call, she was our past chair and has led so much with the school coordinator section and the best practices and a lot of what I'm going to share with you today. Lynn Hammond is our co-chair, and Mary Connolly out of Massachusetts is our member at large. She's very actively involved. And Amy Bashara is our communications representative. She and Sandy are in South Dakota and work with us. And our team changes annually. We serve 1 or 2 year teams, and we're always interested in others becoming involved and helping us to move coordinated school health forward. So during this webinar, I'm basically going to focus on 3 things to get us started. Look at the history of health coordinators, the roles and responsibilities and best practices, and the ASHA supports, leadership, and resources and collaboration that are available. So to start with the history, this slide basically shows that in the beginning, for about the first 15 years, the research showed that the focus of the school health coordinator and where we were making a big impact was really on improving school health instruction. So that was the big focus at the very beginning. With that, the study in 1993 showed that there were 2 significant factors with effective coordinated school health programs, and those were, 1, having health coordinators that are the champions of the program, and 2, having supportive administrators who they called patron saints. And when the 2 of them worked together, we did a more effective job of implementing health education curriculum and instruction. Soon after that, Susan Woolley and Eva Marks wrote a book called Health as Academic, and I hope that you're familiar with this because it certainly was groundbreaking in our field of school health coordination. And basically, they took the traditional school health program model and they changed it into a coordinated school health program model. And within that model, the very first step was really getting school leadership on board, which included an administrator and a coordinator. Soon after that, the American Cancer Society developed a school health leadership training institute. This was a 3-year institute that school health coordinators or lead health folks in schools, up to 50, attended twice a year for several days to really study and learn about and become a professional learning community to study coordinated school health and what an effective health coordinator does. With them were several members from higher education, and together they worked and studied and were a learning community, really, an action research community to see what would work. 5 years into the program, they found that 100% of those coordinators that were involved in that institute felt completely prepared to build organizational capacity in their school districts for coordinated school health, to advocate for coordinated school health, to solicit additional resources to manage the coordination of all the different elements of a coordinated school health program, and to provide the necessary leadership. So through that, they really learned a lot about what works and how to build capacity and best practices within coordinated school health. With that, the American Cancer Society identified these responsibilities. They suggested that each school and district appoint a school health coordinator to assist them in implementing and coordinating all the different health policies and programs to ensure that everything's done well, that the different components are connected, that they give the same messages and they reinforce one another, that they collaborate together, that the superintendent and principal and administrative staff are all integrated with management and supervision of the program, that everyone has the professional development and technical assistance that they need and the resources are there, that the health coordinator facilitates the school building and the community working together in the best interest of the students and their families and everyone's well-being, and that they evaluate it and share those results out. So this is when we really started to get some definition into what a school health coordinator is. And as a result of that, many of the coordinators that were involved in that said, we need to develop our own section at the American School Health Association, and that was when our school health coordinator section was founded. So this, many of you I'm sure will recognize, is the coordinated school health model, and making this work really is a key role of the school health coordinator. So it's to link and optimize all those different connections between those separate components to enhance student health, success, and their overall life achievement. Oops, sorry. Within the health as academic resource, they define a coordinator as having the professional preparation and certification to be able to plan, implement, and evaluate a coordinated school health program, as well as become familiar with all the resources and make all of that connect at a local level, a state level, and a national level. So what you're seeing is there's a lot of different groups informing and lending into what the role of that school health coordinator is. The American Cancer Society put out a booklet that has a lot of direction and a lot of information around best practice for the school health coordinator. It's called the Guide to the Role of School Health Coordinator. And in there, it talks about how the health coordinator is central to making this happen, that they do the management, coordination of a variety of health policies and activities and resources, and that they're responsible for that program administration, implementation, and evaluation. And that school health coordinator position and using those best practices makes a difference between a fragmented approach where we're all working with different silos. This group works with health and wellness. This group works with sexuality. This group works with alcohol and drug initiatives. This group works on staff wellness. But rather that role can help to coordinate all those different folks and all their different planning and policies into one solid, well-planned, coordinated, and effective program and method. The CDC looked at best practices as well, and seeing the importance of these all being done on an environmental and systemic level and approach. And they saw the benefits as a school health coordinator enables schools to eliminate gaps, reduce redundancy, helps them to streamline different funding streams, to build partnerships and teamwork among school health and education professionals, and also collaboration out in the community with public health agencies and representatives and parents and those like so that we all come together, and to focus effort on helping students to engage in positive health-enhancing behaviors and risk behavior. In 2010, Charles Bash came out with his Healthier Students Are Better Learners, a foundational document that put together a lot of the benefits of coordinated school health that it has on academic achievement and on students' motivation and ability to learn. And at the bottom here, you can see the citation if you aren't familiar with it in a previous webinar. Charles Bash did with ASHA and shares his research there. And what he found is that an effective coordination requires a school health coordinator who's aware of all those different programs, services, and policies and how they can be linked together to use limited resources effectively to impact those goals. So this is a landmark piece that really points to a lot of direction and best practices for health coordinators. In 2005, there was a resource study done, and what this did, it really looked at the role of the school health coordinator. And one of the things that you might have noticed with all the earlier slides is that the role of the health coordinator was similar with many of the different efforts, but it wasn't totally defined. There was no clear job description or clear responsibilities. You couldn't say a school health coordinator should provide leadership 10% of the time and should work with accessing funding and resources 5% of the time. And it just didn't, they don't clearly define what it is, and they're somewhat different. So there were different ideas of what a school health coordinator might look like. And if we're really going to promote and move this role forward, since it is important based on the research that we've seen, there's a need to educate school superintendents and administrators about coordinated school health programs and the critical role of school health coordinator. And to do that, there needs to be pre-service training. There needs to be programs offered in colleges around this. There need to be in-service opportunities so that school health coordinators can be trained in essential skills and tasks to really do the job well and effectively. Based on that, ASHA back in 2006, Susan Woolley was the director then, and she worked with some colleagues and applied to the Centers for Disease Control for some funding to really take a look at the role of the school health coordinator and to start to get it more defined and move it forward. Unfortunately, that wasn't funded, but through that work, actually, I was able to pull a lot of the earlier information that's in this PowerPoint, and it really gave ASHA a sense of direction of really moving forward with really delineating the role of the school health coordinator. So in ASHA's current strategic plan, that is one of the goals, to really take a look at this project and see what we might do to move this forward. Last year at the ASHA conference in Louisville that Steve mentioned, we held a pre-conference work session that was sponsored by the American Cancer Society for our members to come together and give input on the roles, major responsibilities, and competencies. You know, it's been 5 years since that early work is done, so a group of us came together and spent the day really looking at this and starting to give input and think about how we can move forward now. From that, these were the 5 key major responsibilities that were identified for a school health coordinator: to perform needs assessments, communicate with school, families, and community, and connect with all of them, to develop and manage school health program, and to evaluate the effectiveness of school health efforts and advocate for school health. Now we're at the next step. We're looking at identifying and providing professional development for school health coordinators, looking at perhaps this being able to guide coursework for graduate degrees in school health coordination, help to put together job descriptions, and who knows, even perhaps develop a credentialing system for school health coordinators. So that's one support that we're working on now at ASHA, and that's available if you'd like to become a member and get involved in this important work. But our section, the school health coordinator section, does a number of things. One of the things we do is we regularly network and share best practices with one another. We have monthly conference call meetings where we talk about various things related to school health coordination. We have two committees as part of our section, one that deals with leadership and another that deals with advocacy and our award, which I'll share with you in just a minute. We have a very close relation with the ASHA School Administrators Council for Coordinated School Health based on the research of needing program champions for us and patron saints for administrators. We need to work together if we're going to move this forward, so we collaborate on a regular basis. And I mentioned we're also involved with the Role Delineation Project. So at this year's conference, we have workshops that are designed for school health coordinators. We have a reception with the school administrators group where we get together and share best practices and network. And we also have a meeting where we all come together during the conference and have a chance to network and share. We're having another pre-conference session this year. It's going to focus on professional development, on best practices for school health coordinators. There's a $75 cost attached to that, but the American Cancer Society is so generous in their support that they have offered to sponsor the first 25 members who register for the pre-conference session. So if you are a member, take a look at that, and we hope to see you register as soon as that opens up. And if you're not a member, become one soon and come join us. It should be a great learning and leading experience. Oops. We also have a Health Coordinator of the Year award. You need to be a member of ASHA to be eligible for the award, and it's for someone who's demonstrated exceptional service in any of these areas: leadership, inspiration, mentoring, facilitation of coordinated school health, leadership practices, in evidence-based and theoretically sound coordinated school health practices, and advocacy, and contributing to the field and helping to build that knowledge base around the role of the school health coordinator and effective school health coordination. One reason I put this in here is that the nomination deadline is May 15th, so you still have a couple weeks left if you would like to go on the ASHA website and get to the awards section and fill it out and nominate someone for the award. Or hand it to someone if you're a school health coordinator and let them know the great work that you've been doing and that this is available to recognize you. Steve mentioned the Journal of School Health. It's filled with lots of different research, best practices that a school health coordinator can use, and it's a great resource through ASHA. And there's, I don't know how many, lots and lots of resources and publications on the website that can really be helpful. I've listed a couple of them here, but by no means does it do it any justice. Also, the Chen List service through ASHA, and I get so much information off of that. We have the regular webinars, and a lot that we offer and do, you're eligible to get continuing education credits. One of the great efforts that ASHA was involved in last year is we were part of the groundbreaking group that put together the National Sexuality Education Standards. And in there is a lot of great information for school health coordinators or school health educators on sexuality education in schools. And it was a special issue of our journal in January of 2012. Another item that's here that school health coordinators and educators can use are our ASHA resolutions. Basically, the resolutions provide several statements that involve breaking-edge research around what best practice is. These are just a few of 21 areas and, I don't know, maybe close to 100 resolutions, but they can inform not only advocacy that you might do, but also they can help inform policies that you might be putting together or best practices that you want to use. Through my work with schools with sexuality education, we found that the resolution on quality comprehensive sexuality education was a guiding light for us with putting solid policy and practices in place in one of the big city schools that I work with in New York State. So that was my quick or not so quick overview. And I'd like to open it up to you. Just how can we assist you with coordinated school health best practices, professional development, and related needs?
Kim, thank you. We can take questions by keyboard. So if you folks are, we have about 100 of you active with us now. And if you have questions related to Kim's presentation, we've received a couple, then please ship those to us. Kim, thank you again. I always learn a lot when I talk to you anyway, and many of you don't know, but I call Kim quite frequently to sort of pump her brain and get information from her related to school health and the things that we should be doing. We'd like to run, before we move to Dr. Antoinette Meeks, just a couple of polls to figure out what exactly those of you on the line do and where you're located. And Lori's pulling up the first one, which is going to ask you the age group that you work with. What are the student age groups that are your daily requirement where you're based? Ready?
Coming in. Yeah.
And folks are responding. Thank you very much. While you do that, I'll give you about 30 seconds. We're going to ask you one more poll after this one, but I should tell you that we do hear the echo on Kim's phone, and we're trying to do the best we can. We tried to set this up a little bit earlier, and sadly we can't really kill the echo. So if I could hear her, if I pay close attention, I hope you'll do the same. Well, are we close enough on this one? How do you stand?
69 even in middle and high school.
So middle and high school ranges. Okay, let's do the other poll and identify what region of the country are you based in. And while that's happening, I'll tell you that if you visit the homepage of the American School Health Association, you can find our daily blog. You can find the pulse, a lot of information which really will give you the heartbeat of the association. You can learn activities and training and special events. We list research and other items that we find from our partners, and we particularly are hoping that we have members of American Association of Health Educators with us today. We did a special outreach for you.
Midwest, Central, and Mountain areas.
So interesting. Midwest, Central, and Mountain are the primary regions. Well, welcome. Thank you very much for joining us today. After Dr. Meeks, I'll talk a little bit about chess credits, and we'll turn without further ado to Dr. Antoinette. Antoinette, she's the project manager for district development assessments in the Office of the Race to the Top Assessments. She's located at the Florida. She previously was the assistant director, and health coordinator for the Department of Education's Office of Healthy Schools in the Bureau of Curriculum Instruction. She's focused on school site health promotion for staff, and she was the team leader for her agency's employee wellness program. Her other professional experiences include teacher of health. She was a physical education, athletic coach, district coordinator for comprehensive health education, safe and drug-free schools, and the district wellness team leader for her school district. Meeks was an education and training specialist for K-12 tobacco use prevention, and she coordinated a college-focused tobacco use prevention program for Florida's successful tobacco program. She served as an adjunct professor at 3 state universities. She's taught the undergraduate, graduate, and postgrad levels. Most recently, she taught distance learning courses for doctoral students. She's a master's certified health education specialist, certified prevention professional. She also holds several levels of certification in health promotion for staff, is an intrinsic coach in health and wellness. Dr. Meeks is currently the chair for the American School Health Association Health Educators section, president of the Society for State Leaders of Health and Physical Education, and she's on the Florida School Health Association board. Phew. Okay, Antoinette, you got a lot to live up to, but it's your turn.
Yeah, I was listening to this and got a little nervous, wondering if I ever go to sleep. So, okay. Can y'all see my screen?
Yes, ma'am.
You're up.
Fantastic. Okay. Let me move to my first slide here. Come on. There we go. The slide that you see here, Keeping Health in Education, is an overview of what I'm going to talk about this afternoon. Kim laid a great foundation, and I'm going to try to build a nice house on top of that foundation. And since we have a lot of middle and high school folks on here, hopefully this will ring some bells for folks as we move forward. So we'll look at some statutory changes that occurred specifically in Florida that weren't necessarily really bad. It felt that way at the time, but we've overcome to a degree, and I'll talk more about that when I get to that slide. And then what for statutes exist out there in our state or in your state that support what you do. Oftentimes, we don't know what the laws are surrounding our part of a student's education. So it's good to know what exists out there that provides a strength for you that can give you guidance as you move forward. Other legislation that may support, that may be directly related to health education, or may have an indirect relationship, something that, again, you can take advantage of, and different opportunities that exist out there, how you can use the different data sources to support you, as well as the variety of partnerships. I've got state partnerships listed in my particular presentation, but there are local ones I definitely took advantage of when I was not only a classroom teacher, but also a district coordinator. I'll talk about some of the initiatives here in the state of Florida, and then race to the top since it's in 46, 48 of our states. So there's a relationship there between what's going on in your state or in the nation and what we do. Knowing the law. In Florida, several years ago, someone decided that health education and physical education obviously had to be extremely similar. So they decided that when students entered high school in 2007, they would no longer be required to take health education as a part of graduation, as part of their 24 credits. But instead, they integrated health education and physical education into one year-long course. Now, what actually occurred was they took a half credit in health education, a half credit in a personal fitness classroom, some activity class, and a third activity course, and pretty much combined those elements into one class. So we lost that standalone course with students having a certified health educator teaching that standalone course. Now, you may have someone who's dual certified teaching the new course that was developed, but that was a huge loss for us. You begin to think in terms of, in many states, you have a classroom teacher who provides instruction at the elementary level. Often they've had one course in their college career on health education. So they're not necessarily experts. They will teach those areas that they're most comfortable with. Moving on to middle school, we integrated already at the middle school level, and that's true again in many other states as well, where you don't necessarily have a standalone health education class. In some cases, people have at least a quarter. Some folks are lucky and they have a semester, and some folks are lucky where students have to have some form of health education each year, or it could be on a wheel. So students get an exploratory wheel, so they get something. But in our case, we were pretty much integrated, and it was science, some social studies maybe, and some physical education maybe. Now, again, these weren't necessarily individuals who had a background in health education, but they may have been provided some form of training by their district coordinator, and the state might have provided some workshops in different regions or as part of conferences. So this was something that was not necessarily favorable for us, and it's not necessarily favorable in many states across the nation when you think in terms of students are going to learn best if they have a certified teacher or someone at least who's taking the credit towards adding that certification onto their licensure. So this is something that would be a lot more positive than having someone who's integrating. If you're integrating, then a student's not going to get the full complement of that particular subject area. So that was not exactly the best thing that could have happened for us. So we had to look at different avenues in terms of other things that we needed to try to do in order to move ourselves forward. So standards that supported us, if you've got a statutes that support us, if you've got state standards, and most states now I believe do, at one point that wasn't true. And so more and more states are including standards in health education. Look at your particular law. In our case, it says that the teacher and the students, everybody's accountable for those standards. So it's what the student has to know and be able to do at that particular grade level or the grade band. Our standards are at each grade through 8th grade and then in a cluster for grades 9 through 12. So if there's a requirement for these standards, that means all of these standards have to be met. Okay, they're integrating us. How do we take advantage of this? How do we move this forward? So that was the first thought. And then secondly, we have a statute that identifies required instruction in health education. It pretty much identifies the 10 components, and depending on what state you live in, it's either 9 or 11 components on average. But we go by the 10 components. We break out mental health and personal health and community and environmental. So we've got 10 components here in the state. Those are all identified as required instruction, not by a grade. So if it's not listed by a grade, it's K-12. So we've got standards that support us, and we've got a statute in required instruction. Two positives. And then, of course, we still have that integration at high school. Not something that's the best in the world, but we're able to say, okay, so districts, what are you doing in order to meet those two statutes that talk about accountability as far as the standards go? It doesn't say maybe, you can pick and choose. It says this is what you have to do, and then required instruction. So we've done quite a bit of educating over the last few years when we're talking to teachers, we're talking to district staff, and if there are other administrators in their school level or whomever is listening to us. We also have a newsletter in the bureau where I worked previous to this particular job, the Bureau of Curriculum and Instruction, that went to the curriculum directors or assistant superintendents in each of our districts. So I had to make sure that I included articles in that newsletter to continue to educate. If you're at the classroom level, parents are a great ally. Help them understand why health education is important. So often people get hung up on one or two of the components that we're responsible for teaching instead of looking at the variety of topics that we cover and the fact that we are pretty much focused on prevention, teaching students to respond in positive ways. We want to ultimately impact behaviors and our attitudes and behaviors. So there are things that we want to do over time, and we can do that if we have consistency in education. What's helped us, I told you sometimes there are indirect pieces and there are some direct pieces of legislation that can support us. In this case, teen dating abuse and prevention education is now attached to our statute for required instruction in health education. And at first I said, well, why would we want them to have that pulled out? That's already represented in different components, mental and emotional, the violence prevention. It's in different categories or different topics already. Then I thought about it and I said, well, actually that's not necessarily a bad thing because it's a hit or miss if we have to integrate. So in grades 7 through 12, 7th, 8th, 9th, 10th, 11th, and 12th grades, these folks have to provide instruction in this particular topic. Well, what was nice about that is it strengthened a partnership we already had with the Florida Coalition Against Domestic Violence. Working with them and their different groups around the state, we put together, actually they put together with assistance from our health education cadre of folks located in the different school districts, public school districts in our state, put together some supplemental lessons. So you had the education folks working with the folks out in the field in this particular category, and they now are pilot testing these lessons, came up with 7 or 8 lessons, 3 or 4 of them are required that folks can use to supplement education on teen dating abuse and prevention education. It's purely meant to supplement and not take the place of whatever the districts are doing. But I will tell you there's been a great need, a lot of conversation behind this, and folks have been excited about receiving this bit of information. And that was something that was implemented in the 2010 school year. Then along came internet safety. I said, we've already got that in our course descriptions, and again, it's inherent in what we do. Then I said, stop complaining. Here's another opportunity. So it's a reminder that, again, these are things that we're already providing as far as instruction goes, but it's also a dialogue to have with other folks who are decision makers to help them understand, well, yeah, we already do this, but that's okay. Go ahead and add it. And it wasn't an add-on, again, because it already existed, but it was another opportunity. So we looked for a lot of free resources out there that would support education, K-12, in internet safety. But again, telling people, but you already probably do this. Look at the things that you're already doing locally within your classrooms, within your district, but here's some other things that can supplement, that can help. So again, opportunities that didn't feel so much like opportunities at the time. Speaking of opportunities, you also have to look at the data that exists for you. There's a lot of local data out there. Take advantage of your local data. What does it tell you? What does it tell you about your students? What does it tell you about the students in your school, the students in your district, the students in your region or your state? Take advantage of that data. If you're looking at ways, looking for ways to support some of the things that you're doing, and you say, well, gosh, I don't have any money. Well, if you've got some compelling data, there are different grants you can write for. Even locally, there may be some folks out there who you just normally just wouldn't think about, or you think, well, I have to write a book in order to be able to write for this grant. Some grants are very, very simple, and people really want to provide some funding for you to do some great things with your students. So look at the different data sources that exist. Some of the ones that we use in this state, of course, the Youth Risk Behavior Survey, and some folks are using or giving the survey to middle school students. We've got maybe 2 or 3 districts in our state that do that, but the rest of them provide or their sample. We have a sample that participate in the high school version, and we look at trend data. We've been fortunate to get weighted data since 2001 every other year when this survey is completed. So we have weighted data now, and we can see the trends with our students, and we take advantage of that data. Districts, if they wish, they can gather local data if that's what they want to do, but that's something that they have to have a conversation with the vendors regarding that piece, because we're provided X amount of dollars from the Centers for Disease Control to complete that Youth Risk Behavior Survey. Then you have the school health profiles. That's done every couple of years as well. And prior to 2006, we didn't achieve weighted data. We achieved that in 2006, and we've achieved it every other year since then. That's some data that also helps us because it tells us what the needs are out there. What can we do as a state, or if I was still sitting in my district role, I can look at it and say, okay, what are folks saying regarding professional development? Okay, well, we already do this. Well, no, here's some data that supports me in trying to do this, because obviously there is a need, and I can show my folks locally that there's a need to provide this particular service. You take that, the school health profiles, you look at what your professionals are saying, you look at what the youth are saying, and you compare the two. And you can also identify holes as far as what's actually being done, in my case, across the state, but you can make assumptions locally. Communities that care involves the risk and resiliency information there, the protective factors and the risk factors, and that's something that on odd years it's state data. On even years, it's local data. So districts and schools are able to really get a solid picture of what's going on at that district level, what's going on across our district, and if they want to, they can break it down school by school. So that's something that they can choose to do, and again, that's every other year. So you've got state data and you have local data. Again, different data sources. And then we have a tobacco use survey where we also gather data to support us in some of our tobacco prevention efforts. We're fortunate enough to have a trust fund in the state that's not connected to any lawsuits or anything like that, where back in the early 90s, might be more like the late 80s, but everything began in 91, if my memory serves me correctly, and we get a certain percentage from retailer licenses and a certain percentage from civil penalties, and that goes into a trust fund for tobacco prevention education. And then, of course, you have the tobacco dollars from the settlement, and that's over at the Department of Health, and they also work with schools and adults. So, again, those are some of the data sources. Best practices as far as partnerships go. You've got Action for Healthy Kids. We've got one in Florida, and I believe they're in most states. We work with the Florida Dairy Council, who happens to work closely with the NFL as well, and they've produced several free products that schools and districts can take advantage of. Both have, the Dairy Council and Action for Healthy Kids, both have websites that where you can access some free resources and some assistance. We have a youth survey work group, which is different state agency folks coming together who have responsibilities. At one point I had the responsibility for the youth risk behavior survey. So we come together and we meet and have discussions over the data, what we need. Let's look at our different questions. Are we repeating things that we don't need to repeat, or do we need to repeat them because we want to see what the trends are as far as those answers are. So those folks coming together. And then when I worked locally, there were folks that I worked with locally on some of the data that we received or was available to us. I talked about the Florida Coalition Against Domestic Violence. Most states have some form of domestic violence coalitions. We also work with the Florida's Child Abuse Prevention and Permanency Council on, of course, abuse prevention as far as our students go. So we relate it to our students, whereas they're looking globally into the community. You look for local groups, again, that you can work with, because in this state they have different folks in the different regions that work with the counties. Out of the Office of Healthy Schools, you have the HIV/AIDS Teen Pregnancy Prevention cadres. They also work with sexual health. And these are folks who represent not only schools but districts and community agencies, as well as some state agencies, and we have some university students who participate on that as well. And lastly, the Health Education District Coordinator Regional Cadre. These are folks who represent, we've broken them into 5 regions in the state, and we've got at least 1 or 2 people from each of the regions who lend their expertise to moving us forward. So they speak for their folks in that region. That's their teachers, that's the other folks who look like them in terms of their job roles, and we try to move health education forward in this state. Other organizations, you've got a school health association, hopefully in your state. Become a member, become an active member. The Florida Alliance for Health, Physical Education, Recreation, and Sport, or AHI on the AFRID on the national level. Make sure you're participating with them. We have the Council of District Administrators, which represent those district leaders for health, physical education, and those could be teachers on assignments, folks who will provide services to teachers. And then, of course, the Florida Association of Professional Health Educators, which is another group within the Florida Alliance for Health, Physical Education, Recreation, and Sport.
I'm going to have to ask you to close down in about 1 minute if you can.
Okay, I will rush on. And then you have the national organizations that you can see there. And again, it's about being an active member of these organizations instead of just receiving information, actually attending conferences. You're attending a webinar now, which is great. Other initiatives that we have there, the Healthy School District Award, you'll see the Department of Education's website. Visit that. That's something that's really, really interesting in terms of a partnership there and different things that we've done in terms of working with our districts and our schools on recognizing those folks who are coordinated school health positive people doing great things for their students. The Summer Academy for Teachers of Health Education, people spend $110. They're there at a university campus for 3 days. That takes care of room, board, everything that they need. Once they get there, they don't reach in their pockets, and they leave with a lot of health education information at the end of those 3 days. And then the Race to the Top, I'm going to have to skip over that, but you can also, that's what I work in now. Please, 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 we're the only state that's focusing in on developing assessment items for health education and physical education. You want to get involved as best as you can in your own states to be a part of this particular effort. And then there's contact information. And the easiest thing to do is to go into www.fldoe.org, hit the site index, and you can get to those 2 websites. Okay, Steve, I ran.
Antoinette, you did great, and I apologize. We had ghosts in the machine at the beginning, and it pushed your time much tighter. but thank you for trimming up. We do have a number of questions that have come in, and I want to let people know that on the ASHA webpage, which is ashaweb.org, you'll find the contact information for both Kim McLaughlin and Antoinette Meeks, and you can directly communicate additional questions to them. And likewise, the PowerPoints they've worked from today will be posted on our webpage tomorrow. I want to make, first, before I turn to a question for both of you to address, we have a very interesting comment, and since we'll be in Texas in October, I'd like to read this one and point out that in Texas, the legislature recently dropped the health course in high school as a graduation requirement. But one district in particular, the Fort Bend Independent School District, chose to keep the health course in the high school as a graduation requirement. We're really pleased to hear that, and we felt like we wanted to make sure that all of our attendees and our faculty heard that point as well in terms of a community stepping up to keep health in the curriculum. One of the major questions that we've had here is that we've mentioned the health is academic, but is there any other more recent books that people could turn to as sort of a basic reference? And I know, Kim, you were nice enough to mention the special issue of Josh that was in October by Charles Bash that we're very proud of. But is there anything else that you would send people to?
That's a good question. I'm willing to research that a little bit more and find out. I'm not aware, quote unquote, of a book. I mean, there certainly are a number of other publications. One of the things that's on the ASHA site, actually in the school administrators section, there are a number of resources there. If you go into the section site and go into the school health administrators section, there's a number of different reports and articles. I bet in that area there you could find a number of things. And Steve, I'm glad to add that link into my presentation before you post it.
Oh, please, that's great. Excellent, Kim. Okay, and Antoinette, to step in with a question here, if you will take the lead. What support is available to advocate for more health education in the school day? For instance, an elementary classroom teacher licensed to teach math, science, language arts, social studies, and health. And many elementary teachers don't include health as part of their daily instruction, and students end up missing many of the skills they need. Could you respond to that?
I can tell you from personal experience, though it wasn't elementary at that time, it was just because I had a natural interest in different things that I started doing things around the school and involving different faculty and administrators, and they began to learn a little bit more about what it was we did in our role at the time, teaching both health and physical education, and that made somewhat of a difference in terms of educating them. But your primary support group will be your parents, because there are things that parents just naturally believe are being taught their children, and when they find out, they say, well, what can we do to help? How can we get more of this into the classroom? And there's also the opportunity to speak in front of the school board and talk about what's true and what's real about the students locally and things that we can do to maybe decrease some of the behaviors. Many of the behaviors that students demonstrate in middle and high school may have had their beginnings in elementary school. So it's showing folks data that we collect on the upper grades and saying, you know what, there's probably a relationship here at the elementary level. So if you can show people that you can impact their students positively, it's eating that elephant one bite at a time. It's educating those people who are the decision makers and parents who help the decision makers understand that this is something that's important to them.
Thank you. Anything to add there, Kim?
No.
Okay.
Thank you.
Okay. Well, in addition, our communications specialist in Kansas City, Heather Gibbons, has let me know that the links to the resources that Kim raised, what school administrators can do to promote school health and what school boards can do, those also have links now on our Facebook page and Twitter pages in addition to our home pages. Well, at this point, I want to thank everyone, particularly our faculty, and thank you for coming in. I want to let you know if you're seeking credit for this, you'll receive an email link to SurveyMonkey, and once you follow the evaluation there, you'll find another link which tells you how to get your CE credits. And we really want to thank you and hope you'll tell others to come and join us. We're hoping to do this again fairly soon, and before we even started, I asked both faculty if they'd help once more. I want to remind you that May the 3rd, this week, we have another webinar, this time sponsored by our Research Council, looking at utilizing secondary data sources for research in school health. Look for information on additional webinars. Our Mental Health Council is working on one about the problems people see in seeking mental health services. More information on that coming soon. Likewise, the 86th Annual Conference of ASHA will be in San Antonio. It's Making Connections, the People, Passion, and Promise of School Health. Thank you all once again. Thanks, Kim. Thanks, Antoinette. Thanks, everybody who across our volunteer network have made this possible. We apologize for the ghosts that we encountered with the software in the beginning. But with this said, consider joining ASHA if you're not a member. We'd love to have you join the family. Thank you very much. Thanks, Kim. Thanks, Antoinette.